Biogen is making a strategic push into lupus treatment, targeting one of immunology's toughest challenges with a 3-drug pipeline. The franchise rests on 3 distinct programs: dapirolizumab pegol, litifilimab, and felzartamab, each attacking a different part of the autoimmune cascade. Lupus splits into 3 major forms: systemic lupus affecting multiple organs, cutaneous lupus impacting the skin, and lupus nephritis targeting the kidneys. Biogen's 30 years in multiple sclerosis built deep neuroimmunology expertise, giving the company a proven foundation for managing chronic immune diseases. Multiple sclerosis and lupus share striking similarities. Both hit young women hard, involve unpredictable flares, and stem from immune system dysfunction. Type 1 interferons drive much of lupus's damage, triggering joint inflammation, kidney harm, and runaway antibody production in a vicious autoimmune cycle. Lupus hits young women hardest, especially women of color, who face 2 to 3 times the risk, often leading to early heart disease and organ damage. The patient journey starts with symptoms like fatigue and rashes, moves through diagnostic testing, then treatment with drugs like hydroxychloroquine, and continues with lifelong management. Dapirolizumab pegol blocks CD40 ligand, breaking the molecular handshake between T cells and B cells that fuels antibody-driven inflammation. The confirmatory Phoenix Fly trial mirrors the successful Phoenix Go design to validate the drug's 44.6% response rate for regulators. In Phase 3, dapirolizumab pegol hit a 44.6% response rate at 48 weeks, helped patients cut steroids, and improved fatigue scores meaningfully. Litifilimab targets receptors on plasmacytoid dendritic cells, shutting down interferon and cytokine production before the inflammatory cascade even starts. Litifilimab's path runs from LILAC Phase 2 validation through Topaz 1 and Topaz 2 trials in systemic lupus, ending with Amethyst for cutaneous disease. The LILAC trials showed strong results across the board: fewer painful joints, better skin scores, SRI-4 responses, and 50% improvement rates in cutaneous lupus. Felzartamab depletes plasma cells and cuts autoantibodies, with early development focused specifically on lupus nephritis and kidney inflammation. Despite many patients qualifying for biologics, less than 20% actually receive them, a gap driven by cost, inertia, and limited awareness. Litifilimab revenue is forecast to climb from $23 million in 2027 to $1.1 billion by 2031, as Phase 3 data unlocks commercial momentum. Dapirolizumab pegol revenue is expected to grow from €50 million in 2026 to €241 million by 2031, reflecting a steady but modest market ramp. Biogen and UCB Pharma share a true 50-50 partnership on dapirolizumab pegol, splitting all costs, profits, and responsibilities equally across the globe. The potential value of Biogen's lupus franchise may exceed what the market currently expects, especially if both programs differentiate and deliver $2 to $4 billion annually after 2030. Biogen's lupus success hinges on Phase 3 execution, regulatory clarity, standing out versus Benlysta and anifrolumab, and strong commercial uptake. Phase 3 failures, safety issues like infections or clotting, regulatory delays, and slow adoption all pose real risks to the investment case. Lupus affects an estimated 5 to 6 million people globally, with roughly 200,000 new cases annually in the U.S., underscoring both the need and the opportunity. Precision immunology, chronic disease management, and biologic commercialization form Biogen's core strengths, honed over decades in multiple sclerosis. Looking ahead to 2026 through 2028, Biogen's lupus programs will face their defining moments as critical data readouts arrive. The timeline unfolds from first Topaz data in 2026 through cutaneous results in 2027, then dapirolizumab confirmation in 2027-2028, reaching commercial peak after 2030. Biogen's current valuation may not fully reflect the lupus franchise's potential, with consensus models possibly missing upside if the programs succeed. The key question is no longer whether lupus can be treated. It's whether the market fully appreciates how big this category could become.